Hey, my name's Diana, and this is my cervical cancer. Are you at risk? Scholarly paper PSA. So, cervical cancer background and statistics. Education is key when we talk to our patients. Cervical cancer is the fifth top cancer globally. Approximately 13,000 Americans are diagnosed annually, and over 4,000 of those die. In Tennessee, in the year 2016, 300 cervical cancer cases were reported, while in Texas there were over 1,200 cases reported, and 90% of deaths occur in low to middle income countries, and that's because women find it difficult to get properly screened, diagnosed, and treated, which often leads to fatal outcomes from cervical cancer. This is a slide that shows from 1999 to 2016. Basically what I talked about in the last slide, it shows that annually there's about 13,000 reportable cervical cancer cases each year. Facts about cervical cancer: most women are diagnosed between the ages of 35 to 44 years old. African Americans and Hispanics have the highest rate of HPV-acquired cervical cancers, and this is basically because they have a lower compliance with testing, becoming vaccinated, and treatments due to lack of resources and income. African Americans are the primary breadwinners for their families, and they often put their own health on the back burner. So when they have symptoms, they just avoid them, and then when they go to the doctor, the cervical cancer is already in the advanced stages. Risk factors for cervical cancer. We know that HPV 16 and 18 is the two most dangerous types, which leads to 70% of cervical cancer. There's 120 different types of HPV today in the United States, and what leads to HPV 16 and 18 is many sexual partners and not using condoms and having unprotected sexual intercourse. Other risk factors include HIV, smoking, oral contraceptive usage, and just your genetics. And this is a picture of what a healthy cervix looks like and then a carcinoma. Screening recommendations: we talked about this in class a few weeks ago, and my preceptor follows these guidelines. She will not do a PAP before the age of 21, regardless of sexual activity. And then HPV co-testing is recommended to start at the age of 30 and then every 5 years. Symptoms of cervical cancer: most women are asymptomatic until the cancer is in the advanced stages. And two common symptoms that women will seek medical attention is abnormal menstrual bleeding or bleeding after sexual intercourse. And these symptoms could also go along with something else, so women may still also blow this off to be no big deal. This is also another picture of what a healthy versus low and high grade cancer would be. Gardasil 9, it was approved, and it's the only approved FDA vaccination in the United States. It's recommended in a 2 to 3 dose series for boys and girls beginning at the age of 11, and also can be given early at the age of 9, and it's given as an IM injection. I read that if it's given before the age of 15, they get the 2 doses. If it's given after the age of 15, then they get 3 doses. And challenges that I learned writing my paper is that there's lack of insurance, fear of doctors, lack of knowledge, and stigma surrounding STD testing, that people don't want to go to the doctor. School nurses can be resourceful and get more information out to children regarding becoming vaccinated with the Gardasil. And then also Gardasil could give the green light on premarital sex with the abundance of sexual partners, and the fear that the vaccine has not been properly tested, causing developmental delays and mental retardation in children. And in my conclusion, the World Health Organization wants to decrease cervical cancer rates by 70 to 90%, and they want to do that by increasing vaccination rates, by increasing vaccination rates and then assisting those who can't afford to receive treatments.